Hi, everyone. Every day, our patients look to us for guidance about their oral health. And here's the truth: the way we talk about treatment can either build trust and commitment or create hesitation and delay. That's why today we're going to focus on three pillars of case acceptance. Number one, recommending care and helping patients start today. Number two, recommending care and guiding patients to schedule today. And number three, recommending care in a way that helps patients confidently say yes. Sometimes patients nod politely and say, I'll think about it. Other times they delay scheduling or avoid committing altogether. That doesn't always mean they don't care about their health. Often it means they don't feel heard or included in the decision. This is where humble inquiry changes everything. When we ask before we tell, we invite patients into the conversation. We stop being lectures and start being partners in their care. And that's what turns hesitation into commitments. Pillar number one, this is recommending care and wanting them to start today. Dentists, instead of just telling the patient you need a crown on this tooth, try saying, what have you noticed about this tooth when you're chewing? Does it ever feel weak or sensitive? And if the patient responds with symptoms, then try saying, that's what I'm seeing too. This tooth has a crack that can worsen. Would you feel better if we protected it today so it doesn't break further? And what if the patient says that they don't feel anything? Then you can respond, that makes sense. Sometimes cracks don't cause any pain until they progressed. What we want to do is protect the tooth before it surprises you with discomfort so it stays more predictable. How would you feel about addressing it now? Hygienist, instead of saying we should do scaling and root planing, you can try this. Can I show you this area on your x-ray? What do you notice here around the roots? You're going to get a different response. And after the patient shares what they see, then you can respond, that's bone loss and it's caused by gum infection. What do you know about gum health? Would you like us to start treatment today so we can stop the infection before it progresses? Or instead of suggesting fluoride therapy by saying you need a fluoride treatment, how about sharing using humble inquiry? Try saying it like this: do you feel any sensitivity here around this root on the upper right? And then after the patient shares their answer, then you can say, that's why I'm recommending fluoride. If we start today, it can help with what matters most to you, preventing sensitivity and further protecting that root structure from decay. Now, what if the patient says, I don't feel anything? Then you can say, since you mentioned you don't feel anything now, what's most important to you? Staying ahead of the sensitivity or protecting that exposed root from future decay so it stays more predictable? Let's talk about pillar number two, recommending care and guiding patients to schedule treatment today. Instead of saying, let's get this crown scheduled, try saying it like this: how soon would you feel most comfortable taking care of this tooth before it becomes more serious? Or, our front office team can definitely help you reserve a time that works best for you. Dentists and hygienists, instead of saying you need a filling, we'll need to schedule that right away, try saying, if this cavity grows, it could turn into a crown or even a root canal. Would you feel better getting it handled soon while it's still predictable? The front desk can help you choose a time that works best for your schedule. And instead of saying, we'll need to reappoint you for scaling and root planing, we could try saying it a little bit different. To get your gums healthy again, we'll need to do two visits. Would you like to start with the right side where I see more tartar or the left side? Now, on to pillar number three, recommending care and wanting the patient to say yes and accept treatment recommendations. Instead of saying you need this treatment, we can try saying it a little different, like this: what concerns you most about your smile or your health right now? Let's make sure our plan addresses that for you. That way we stay aligned, right? So here's your homework activity. You're going to do some chairside reflection. After two patient presentations each day this week, jot down What did I say? How did the patient respond? How can I phrase it differently, like humble inquiry, right? To get a different result. Lastly, add inquiry questions. Replace one direct phrase you say often with a humble inquiry question. Discover one success, one struggle, and one moment where a patient leaned in a little differently because of the way you asked. Humble inquiry doesn't take away our role as the expert. It makes us better guides in care. When we can ask before we tell, patients feel heard. They say yes, not because they feel pressured, but because they feel like a partner in their own health. So let's go out there today and practice humble inquiry in the operatory. Each question we ask builds the trust, and every yes we earn moves our patients closer to better health, and that leads to overall practice success.